This is Timothy McCall. This video is for the Yoga as Medicine Level 2 course called Yoga Therapy for the Nervous System. If you want to learn a little bit more about me, you can look at the video I did describing the Yoga as Medicine Level 1 course. By the way, you can also find much more detail about my biography on my website, drmccall.com. So, Yoga as Medicine, Yoga Therapy for the Nervous System, the Level 2 course, first thing I should say is that while I encourage people to take the Yoga as Medicine Level 1 course first, it's not a strict requirement. You can get some of the background by reading particularly the initial chapters of my book, Yoga as Medicine, but this course, as with the Level 1 Yoga as Medicine course, goes well beyond what's presented in the book. Now, in this course, we focus on yoga therapy for the nervous system. This means using an awareness of the nervous system in our yoga therapy prescriptions for diseases of the nervous system and other diseases, really any disease in which an imbalance in the nervous system may be playing a controlling role, or a contributing role, I should say. So, for example, really any stress-related disease is potentially related to the nervous system, since the autonomic nervous system, sympathetic and parasympathetic nervous system, how well each of those branches works independently and how well those two branches of the ANS work together can be crucial to everything from hypertension to autoimmune disease to heart attacks. Really, it's a broad spectrum that can be affected by the level of stress in the body's stress hormones, and all of that. We talk about trauma, both psychological and physical trauma, which can lead to major changes in the setting of the nervous system. Now, particularly when that trauma happens early in life, it can be harder through yoga therapy to change it, but it absolutely still can be changed. Just old habit patterns, including habit patterns in the autonomic nervous system, take more repetition and sometimes more time to change, but you can change them. And particularly in cases where dysfunctional breathing is contributing to disease, when we repattern the breathing pattern, which we absolutely and very successfully can do in yoga therapy, it can make a huge difference, not just in the disease, but really in the whole person's life, in their state of well-being, their psychological well-being, their physical well-being. Really, everything is potentially affected by the breath. Now, we're going to do practices like pranayama, yogic breathing techniques. We'll be spending some time on restorative practices. But the main focus of this training, as with all the Yoga as Medicine workshops, is casework. We're going to break down into groups. Some of the participants in the workshop will be the patients. Some will be working in teams, usually 3 or 4 people together, working collaboratively. And because the cases can be so different, it's always a different workshop. And there's almost always interesting things. Nervous system disease can, of course, be things like Parkinson's disease and multiple sclerosis. Disease is primarily of the central or peripheral nervous system. It could be skin diseases because, of course, the skin derives from the same layer as we develop as a fetus, the same level embryologically as the nervous system. So often you'll see manifestations in the skin with nervous system diseases or skin conditions like eczema, for example, that may be greatly affected by the state of the nervous system. In the casework we do in the nervous system training, we also look at the whole holistic picture. So again, I use the SNAPS model, structure, nervous system, and breath, Ayurveda, psychology, and spirituality. We look at all 5 of those areas in our evaluation and in our prescription of yoga therapy routines. The lectures will be primarily on the nervous system, going into more detail than I cover in any of my books or other trainings on the nervous system, on the anatomy, on the physiology of the nervous system. The level of detail that you'll need to do yoga therapy successfully. Not exhaustive, not overly academic, but a real kind of functional understanding of what's going on. Ayurveda is hugely important in nervous system diseases. Vata disturbances, which are the most common disturbances we see, they're endemic in our modern culture with all of its overscheduling and multitasking and audio and visual disruptions to our lives through media, etc., smartphone and computer use. So many things in the modern world are Vata disturbing. And so part of healing a lot of nervous system conditions is paying attention to keeping Vata balanced. So we'll definitely be talking about that. But really, the precise things that happen in these workshops often really follows from the cases we see. And that's what makes every one of these workshops different and keeps them fun and interesting for the students and for me. We tend to have varied groups: doctors, nurses, yoga therapists, yoga students, people seeking help for conditions. We have different backgrounds. We have a collaborative experience. We learn from each other. It's intense, but it's a lot of fun. And I hope you'll consider joining us for one of these trainings. Thanks much. Hope to see you. Take good care. Namaste.